Tissue Integrity, Part 8, Introduction to Nursing Concepts, Martha Olson. As we look at the diet needs for the person trying to heal a wound or prevent wounds, we know that page 1186, table 48.4 will help us. We look at protein, we look at vitamin C, A, E, and zinc, and the additional glucose needed to repair the wounds that the person has. As we look at the healing, we can lose as much as 50 grams of protein a day from an open weeping pressure ulcer or wound. So when we look at how much protein a person would need, it becomes important that we do the math. A usual person needs 0.8 grams per kilogram per day, but that would increase for a person up to 1.8. So if you take your weight in kilograms times 1.8, that is how much protein a person that is trying to heal a wound. In the burn unit would be a perfect example of somebody that would need more protein per day to supplement the wound healing process. When we look at controlling and eliminating causative factors such that we've been talking about in past video presentations, the pressure, the shear, the friction, moisture, all things we can do something about. We expect them to have an IV with fluids running to support the kidneys. And when we look at maintaining that wound environment, remember we want to keep it clean. We want to keep it moist, and we want to eliminate any dead space, and that's where that packing and debriding comes in, because we don't want to pack it in so tight that it can't, that it damages that tissue in there, but we also want to make sure that it heals from the bottom up by secondary intention. Otherwise, if we simply put something over the top, you would have an empty space in there that would definitely promote the growth of bacteria and not heal correctly. So when we look at bacteria grow well in that warm, wet, dark environment, we know then that we have to change saturated dressings, as appropriate. Evaluation, consulting with a wound specialist if it's not healing is important because they are specialists in helping us to do that. On the right is that wound vac that I was talking about in the PowerPoint number 7, where you've got to have it on very well, and then it's like this black, what's the word I'm looking for, kind of black coal that gets tucked in there, and it's cut so that it fits perfectly, and then a lot of tape goes over that area to seal it so it gets that negative pressure. If it's not working, oftentimes it's a matter of just troubleshooting, just kind of playing with that wound vac in an attempt to try to find where it's leaking or what's happening, and it gets very expensive when you have to keep taking it off and getting new supplies for that. As we look at documentation, page 1216 has this picture where we would want to measure the wound. We would throw those away after we touched that wound bed or got that near the wound bed. Make sure that we document what it looks like, the size, the location. Does it have sutures or staples intact? What do the edges look like? Approximated means they're well put together and even, or they're not approximated. Do you have a drain present? What is the amount and color of the drainage coming out of that? Is there an odor to that wound? Because example, like copious amounts of whitish drainage noted would be a sign of possible infection and need to be reported to the doctor. So we will be practicing in the lab and also in the classroom on what we would say in documentation. Our special considerations are pediatrics, our older adults because of their thin skin, and then your patients that have the dark skin that becomes a little more challenging to sometimes assess. This pediatric patient has a severe burn, and unfortunately these are patients that you feel very bad for because pain control, loss of fluid, risk for infection, disfigurement are all too common. With adults, we use the rule of 9s when we talk about burns, just to give us a very quick guide of how much of their body surface area is burnt. But because children have different body surface area measurements, the rule of 9 does not work well for them. The thinner layers of skin increase the risk with heat and cold therapy, and then a child also has, again, that larger body surface area that needs to be considered when we work with them. We will be doing some case scenarios in class where you have a pediatric burn victim come in. Some of it, is very accidental. There are other ones that you have to question if there was abuse. One of the ways of abuse is to take hot scalding water and lower the child's feet into that. And so you may see just like a sock-like burn to that child that is a victim of the abuse. Burns can also be from electrical, hot water. Kids are climbing and get into portable heaters that people use in the bathrooms this time of year. Again, you'll always go back to support the airway. Get large bore IVs in place. We wrap them in plastic to hold their heat and their moisture in. A lot of times we'll put sterile wet dressings over them to maintain that moisture, and then consider intubation if you feel like the airway is being compromised. These are kids that go to the burn units in Omaha or Iowa City, and we don't keep them in areas around here because we don't specialize in them. Assessment of your dark skin patients. Again, we look for changes to the skin color, purplish, maybe brownish or blue. Sometimes that hue of blue under dark skin is hard to pick up. Try to get them in like a natural light by the window or a light source that's more natural. Page 1178 in Potter and Perry, box 48-2 assesses this, where we look at the boggy or edematous feel that can indicate a stage 1 pressure ulcer. Ask if they have any itching or if the skin feels differently. That can also be an indicator for you. 1177 is where this information comes from. It's a lot of information on one slide, but what we need to look at is their risk. 20% loss of dermal thickness. They often have other medical conditions. They're on steroids. They take diuretics that dry out the body and the skin. And so sometimes we are kind of fighting an uphill battle with the older adult, trying to keep that skin intact and free from infection or other problems. They have decreased tactile sensitivity and pain perception. Their blood vessels are very fragile. We know they have decreased sub-Q fat over the bony prominences. So many of the changes that happen naturally with aging predispose them to skin issues. Our risk for skin tears increases with age as they use assistive devices such as walkers or wheelchairs. Sometimes they bump into those. Their cognitive or sensory impairment, your patient with Alzheimer's, or maybe they have diabetes with lower extremity, decreased sensitivity, maybe their eyesight is bad and they run into things constantly. So for the elderly, there are many risk factors besides just the thinning of the skin that predispose them to issues. 80% of skin tears occur on the arm and hand. And as I said earlier, many of them will wear long sleeve shirts as a result of knowing that. Looking then at the very end of this, we look at a pressure ulcer versus a skin tear. Both very common in the elderly, but remember, your pressure ulcer is going to feel boggy, have a reddened area in stage 1, and then open up in stage 2, 3, and 4 to be even more severe. A skin tear can be very small or it can be large, with or without the flap, and it needs to be clean and dressed so that it can heal appropriately. Pressure ulcers are from unrelieved pressure, resulting in damage. Pressure ulcers are located over bony prominences where the skin tear is usually the hand and arm. Pressure ulcers take longer to heal than a skin tear. Your pressure ulcer is from unrelieved pressure, resulting in damage to the tissue. And pressure ulcers are usually located over bony prominences, especially the sacrum and the heels are the two areas that we talked about being more common. And so we've talked a lot about many issues in this tissue integrity. We will reinforce all of those with activities in the classroom. So come prepared to learn and to do many things, because the skin is the largest protective part of the body and can have a lot of issues with it. Have a great day. Thanks.